Welcome to Vpaw.ai. I'm your host, Mike, and joining me today to help navigate our research is our expert, Susan. You can sponsor this podcast for just $25. Your message will be featured across major platforms like Apple Podcasts, Amazon Music, Spotify, and more. If you're interested, visit Vpaw.ai to get started today.
I'm really glad to be here. And honestly, I think today's topic is something everyone needs to hear.
Yeah, absolutely. So let's just unpack something that affects millions of people, maybe even you listening right now or someone you love.
Right.
I want you to imagine a scenario. Let me just paint you a picture here. You're in your 70s, okay, and you feel absolutely great.
You're genuinely healthy.
Exactly.
Yeah.
You're sleeping 8 uninterrupted hours a night. Your energy is decent. You're out there gardening, playing with your grandkids, doing the things you actually enjoy.
Living your life.
Living your life. And then you go in for your annual physical, just a routine checkup, right? Nothing special. Your doctor glances at your chart and says, you know what? Let's run a few tests just to be safe.
And you just nod.
Right. Because why wouldn't you? We are all conditioned to trust that proactive testing is always the smartest move. Catch things early.
Right. That's the mantra.
But then, like 6 weeks later, you're sitting in a surgeon's office. Not because anything was actually wrong with you. Not because you had a single symptom.
Nope.
But because those just-to-be-safe tests found something. And finding that something set off this crazy chain reaction that your body, at your age, simply was not equipped to handle.
It's devastating.
It really is. Suddenly, that quiet, enjoyable life you had, completely destroyed. And the craziest part is, it wasn't destroyed by a disease. It was destroyed by the tests themselves.
Yeah, and that exact narrative, it plays out far more often than the medical system really likes to admit.
Which is terrifying.
It is. So the goal of today's exploration is to look closely at what the medical literature actually says about this phenomenon.
Right.
We're going to examine 5 specific routine medical checkups that adults over the age of 65 or 70 should seriously reconsider.
Things we just accept as normal.
Exactly. We really need to explain how the mathematical reality of medical risks and benefits completely flips as we age.
It's a totally different equation.
It is.
Yeah.
Because right now, the system is running on this kind of autopilot, and it isn't always serving you.
Okay, so before we get to those 5 specific checkups, we really have to establish why this happens in the first place.
The underlying mechanics of it.
Right. Like, why does a completely harmless test suddenly become super dangerous just because you've celebrated a few more birthdays?
Well...
Oh, wait. Let me share this thought I had while reading through our material. It made me think of the aging body like a beautifully maintained vintage car.
Oh, I like that.
Right. So say you have a 1968 Mustang. It runs great. It drives wonderfully on a Sunday afternoon.
A classic.
Yeah. But if you take it to a modern mechanic who aggressively tries to replace every single slightly worn-out part to match the exact factory new specifications of a car rolling off the line today...
They're going to tear the whole thing apart.
Exactly. They might actually ruin that classic engine just trying to make it perfect on paper. It's too much intervention.
That is a perfect analogy. And when you apply that vintage car idea to human biology, the medical literature frames it through what we call the longevity lens.
The longevity lens.
Yeah. See, when you are 50 years old, screening medicine works beautifully. The math is very clean.
Because you have a lot of life left.
Right. You find a problem early, you fix it, and you potentially buy yourself 30 more years of healthy life. The investment totally pays off.
Makes sense.
But after 70, that longevity lens shifts dramatically. And it's driven by a few distinct biological factors.
What's the main one?
The most prominent is the discovery of what researchers call slow growers.
Slow growers.
Yeah. Basically, many of the conditions detected by routine screenings in older adults are never actually going to harm you.
Really? Never?
Never. They grow incredibly slowly, they cause 0 symptoms, and honestly, you will likely outlive them. But here is the crux of the problem. Once those abnormalities show up on a radiology report, modern medicine doesn't really have a leave it alone button.
Right. They see a target and they want to shoot it.
Exactly. It only has a treatment button.
So the clinical machine just turns on automatically.
And you get swept up in it.
And that collides directly with the fact that an older body has a much lower tolerance for intervention.
Right. A significantly lower tolerance.
Because your cellular repair mechanisms, they just handle trauma differently as you age.
Oh, totally. Think about anesthesia.
Yeah. A surgery that a 55-year-old bounces back from in 2 weeks, say, clearing that anesthesia through a highly robust liver, that exact same procedure in a 78-year-old can result in months of difficult recovery.
Or serious secondary infections.
Or even a permanent loss of independence. Which is just tragic.
Which is what initiates the third part of this, the cascade effect.
The cascade effect.
Yeah. So a test finds a tiny, completely meaningless abnormality, but the doctor is legally and professionally obligated to investigate it.
They can't just ignore a weird spot on an image.
Right. So that triggers a follow-up scan. The scan leads to an invasive biopsy. The biopsy leads to a surgical procedure.
And then the procedure causes a complication.
Yes. And suddenly, you, the person who walked into the clinic feeling perfectly healthy, are trapped in an absolute medical nightmare.
All of it triggered by looking for a problem you didn't even know you had.
Exactly.
Okay, let's apply that longevity lens to something we universally accept as mandatory, which brings us to our first major category, the overdiagnosis trap in colonoscopies and cancer screenings.
This is a big one.
It is, and honestly, I have to push back here. Because we have been conditioned our entire lives to believe that catching cancer early is the ultimate holy grail of medicine.
It's practically a religion.
It really is.
Ah.
If there's a tumor in my body, I want it out. How can actively looking for cancer possibly be a bad thing?
I know, it is entirely counterintuitive, which is why it requires such careful nuance.
Okay, clarify that for me.
Well, no one is saying to ignore aggressive symptomatic cancers, obviously.
Right, if you're sick, get treated.
But what the data shows is that for asymptomatic individuals over the age of 75, routine colonoscopies carry enormous, under-discussed risks that actually outweigh the benefits.
Really?
Yeah. Take a case detailed in our research about a woman named Dorothy.
Oh, yes, I read about her.
She was 77, a retired librarian living in rural Tennessee.
And she had clean colonoscopies in her 50s and 60s, right?
Exactly. Absolutely no symptoms, no family history. But her doctor said, it was time for a routine check.
And she didn't want to be a difficult patient.
Her does.
The irony in her story is just heartbreaking to me. She never even made it to the actual colonoscopy.
No, she didn't.
To prepare for the procedure, you have to drink that intense liquid prep the night before to clear your bowels out.
Which is brutal at any age.
Let's talk about the physiology of that for a second.
Yeah.
That fluid pulls massive amounts of water into your intestinal tract to flush it out. It creates these extreme osmotic shifts.
Massive shift.
For Dorothy, at 77, her kidneys simply could not handle that rapid fluid loss.
They shut down.
Yeah. By the morning, she was dizzy, confused, and she couldn't even stand up. She had to be rushed to the emergency room with severe dehydration and dangerously low electrolytes.
Her heart was literally at risk of an arrhythmia.
She spent 4 days hospitalized just from the preparation liquid, not even the test.
And she didn't even need the procedure to begin with.
Wait, really?
Really. The United States Preventive Services Task Force, which is the absolute gold standard for these guidelines they officially recommend against routine colonoscopy screening for average risk adults over 75.
Because of the prep?
The prep is part of it. But beyond the prep, the procedure itself carries a 1 in 500 risk of bowel perforation.
Puncturing the colon.
Yes.
I mean, I hear you on the risks of the prep and the procedure, but if the alternative is missing a fatal cancer, isn't a 4-day hospital stay worth it in the grand scheme of things?
If the math supported that, sure, yes.
But it doesn't.
No. The statistical reality of slow-growing cancers versus your life expectancy completely negates that logic.
How so?
In a 77-year-old, a bowel perforation doesn't just mean a hospital stay. It can mean emergency surgery, a permanent colostomy bag, and the absolute destruction of their quality of life.
Oh, man.
All to look for slow-growing colon polyps that statistically would take 10 to 15 years to ever become symptomatic.
So she'd be in her 90s before it even bothered her.
Exactly. And if you really, really want to screen, there are far safer alternatives anyway.
Right. The non-invasive stool-based tests. Things like Cologuard or a Vpaw.ai test.
Highly effective.
Let's define that really quick. Vpaw.ai stands for Fecal Immunochemical Test. It specifically looks for hidden hemoglobin or blood in the stool, which can be an early indicator of an issue.
And you do it at home.
Yeah, no fasting, no harsh prep liquids, zero risk of a punctured colon.
And, this exact same principle of overdiagnosis applies heavily to aggressive PSA testing for prostate cancer, too.
Okay, PSA. Let's break that down.
Yeah. So PSA stands for prostate-specific antigen. It's a protein produced by the prostate gland, and it's totally normal to have it in your blood.
Right.
But as men age, the prostate naturally enlarges, which can cause PSA levels to rise without any aggressive cancer being present at all.
But the tests don't know the difference.
Well, imaging technology today is so incredibly sensitive, it will spot these biologically sleepy tumors.
Healthy tumors.
Yeah, tiny, slow-moving anomalies that you would die with, not from.
Like the story of Richard from the medical literature we reviewed. He
Exactly.
was 79 years old, a retired mechanic. The guy is totally independent, spends his weekends fishing, feeling great.
A perfectly healthy older guy.
Right. And he gets a routine PSA test, and it's slightly elevated.
Which triggers the cascade.
Yep. That triggers a needle biopsy, which confirms a low-grade, slow-moving prostate cancer. So he gets radiation therapy to treat it.
To treat something that wasn't bothering him.
And what did he get for trading in his fishing weekends? Chronic fatigue, severe urinary incontinence, and a completely diminished quality of life.
The tragic part is the clinical machine just took over.
It's like a runaway train.
It really is. The moment the word malignancy is written on a radiologist's report, the momentum is nearly impossible to stop. Doctors refer, specialists intervene, and patients panic.
Because it's the C word.
Exactly. But Richard's cancer was the kind that simply didn't pose a threat to his actual lifespan. We are destroying people's golden years by treating things that never needed treating in the first place.
That is so wild. Okay, so if catching slow-moving cancers represents the danger of overtreating, our next category represents the danger of false alarms.
Yes, false alarms are huge.
Let's move to the cardiovascular and skeletal systems, specifically stress tests and DXA scans.
Okay.
Taking an asymptomatic cardiac stress test is honestly like pulling a fire alarm in your house just to see if the sprinklers work, only to find out the resulting water damage ruins your entire living room.
That is exactly what it's like, because a routine cardiac stress test sounds incredibly responsible, right?
Yeah, you get on the treadmill, see how your heart does.
You hop on a treadmill to see how your heart handles exertion. But if you have no symptoms, no chest pain, no shortness of breath, the false positive rate for these tests can be 40% or higher.
Wait, 40%? Why is it that high? That's practically a coin flip.
It is, because as the cardiovascular system ages, the blood vessels naturally stiffen. You develop these microvascular changes that can look like major blockages on an EKG when your heart rate goes up.
Oh, I see.
It's normal, age-related wear and tear. It is not an imminent heart attack. But remember the cascade effect we talked about?
Right. The doctor can't unsee the test result.
Exactly. A doctor cannot legally or ethically ignore an abnormal result. That false alarm sends you directly to the catheterization lab.
Which is major. Let's just be clear. They thread a thin tube through a blood vessel in your wrist or your groin, pushing it all the way up into your heart.
It's highly invasive.
That carries severe risks of bleeding, arrhythmias, and ironically, triggering the exact heart attack you were trying to prevent.
And here is where the medical literature gets truly fascinating.
Tell me.
If they find a partial blockage during that catheterization, which is incredibly common and often completely silent in adults over 70, they might put in a stent to prop the artery open.
To fix the plumbing.
Right. But according to massive clinical trials, like the ischemia trial, putting a stent into a patient with stable coronary artery disease does not reduce heart attacks or extend life any more than simple medication and lifestyle management.
Wait, let's unpack the mechanics of that.
Sure.
You go through the false alarm, the catheter in your heart, the surgical placement of a stent, and you don't even live longer than if you had just taken medication and gone for a 30-minute walk every day.
Nope.
Why wouldn't opening the artery help?
Because heart attacks are usually caused by soft, unstable plaque that suddenly ruptures and causes a clot. They are not caused by the hard, stable plaque that a stent props open.
Oh, wow. So you're fixing the wrong type of plaque.
Basically, yeah. The stable plaque just limits blood flow a bit when you exert yourself, which is totally manageable with medication.
But the surgery adds new risks.
Huge risks. Once you have a stent, you are subjected to a lifetime of blood thinners to prevent clots from forming on the metal inside your artery.
Because your body knows it's a foreign object.
Exactly. And those thinners carry massive risks of internal bleeding. You've introduced a lifelong severe risk for zero statistical survival benefit.
That is mind-blowing.
Yeah.
And we see that exact same automatic pipeline with our bones, right? The routine DEXA scan.
Oh, yes. The DEXA scan pipeline.
Let's define what that is for a second. DEXA stands for Dual Energy X-ray Absorptiometry.
It's essentially a very low-dose X-ray that measures bone mineral density.
Right. Now, osteoporosis is a very real danger, obviously, and falls in older adults are devastating.
They absolutely are.
But the issue is the default reaction. You get a routine scan, it shows expected age-related bone thinning, and automatically you are prescribed a bisphosphonate medication to slow down bone loss.
And the hidden risks of those medications are deeply concerning because of how they work on a cellular level.
How do they work?
Well, your bones are constantly remodeling themselves. Cells called osteoclasts break down old bone, and cells called osteoblasts build up new bone.
Like a construction crew tearing down the old and building the new.
Perfectly said. Now, bisphosphonates work by essentially killing off the osteoclasts.
So they stop the demolition crew.
Exactly. The bone stops breaking down, which makes your density numbers look absolutely fantastic on your next DEXA scan.
But the bone isn't actually healthy.
Right. Over a decade, because the bone isn't naturally remodeling and clearing out microdamage, you are left with old, brittle bone.
Like dry wood.
Yes. Our research shows long-term use is associated with atypical femoral fractures, meaning your thigh bone, the thickest, strongest bone in your body, can just spontaneously snap while you are walking down the hall.
Just from normal walking.
Yes. Not to mention the risk of jaw osteonecrosis.
Oh, I read about that. That's an incredibly painful deterioration of the jawbone, right?
It is awful, which is why we need to look at alternatives instead of just defaulting to pills.
Okay, what's the alternatives?
The single most effective intervention for preventing fractures in older adults is not a pill that freezes bone remodeling. It is fall prevention.
Preventing the fall in the first place.
Exactly. The data shows that structured balance training, specifically Tai Chi, reduces the risk of falling by nearly 50%.
50%.
Yes, it outperforms medication in preventing broken bones, and it has absolutely zero side effects.
But a routine scan almost always leads to a prescription pad, not a Tai Chi class.
Which is the whole problem with the system.
So if medications and stents have these hidden traps, let's look at a totally non-invasive test. Our fourth checkup is the silent surgical threat, the carotid ultrasound.
This one is tricky.
Now, I really need you to explain this one to me because checking the blood vessels in your neck with an ultrasound is literally just sound waves bouncing off tissue.
It's very gentle.
There's no radiation, there's no intense liquid prep, there's no needles. How on earth could simply looking at a neck artery with an ultrasound be dangerous?
Well, the danger isn't the ultrasound itself. As you said, the imaging is perfectly safe.
Right.
The danger is finding a completely stable, silent blockage.
The cascade effect strikes again.
It strikes again, and the logic seems sound, right?
Yeah.
Find a blockage in the neck, surgically clean it out, and prevent a future stroke.
That seems like common sense.
But the reality for asymptomatic patients is shocking. The surgical procedure to clean out that artery is called a carotid endarterectomy. The surgeon clamps the artery, slices it open, and physically scrapes the plaque out. But in doing so, they carry a 2 to 3% risk of breaking off a tiny crumb of that plaque.
Oh, no.
Yeah.
And because it's the carotid artery, that tiny crumb of plaque flows directly upward into the brain.
Yes.
So the surgery actually causes the exact stroke it was supposed to prevent.
Yes. That is exactly what the medical literature documents.
That is horrible.
It is. In older adults who have no symptoms, no history of mini strokes, no unexplained vision issues, the United States Preventive Services Task Force explicitly recommends against this screening.
Just don't even look.
Don't look. The risk of surgical harm simply outweighs the theoretical benefit. The plaque in those arteries is often perfectly stable and has been there for a decade.
So what did you do instead?
Leaving it alone and managing blood pressure with safe, standard medications is a far safer, far more effective investment.
It really highlights how doing nothing, or rather deliberately managing lifestyle factors instead of cutting into the body, is sometimes the most medically advanced choice you can make.
I completely agree.
Which leads perfectly into our final section today. We need a defense strategy.
Yes, we need tools.
Because when you are sitting in that exam room, right, in that paper gown, and your doctor says, let's run this test just to be safe, you need a toolkit to advocate for yourself without feeling like a difficult patient.
You are allowed to ask questions.
Exactly. And our material outlines a brilliant 5-question framework. So let's walk through a hypothetical scenario.
Let's do it.
Say my doctor wants to order a routine scan. My first question should be about the false positive rate for my specific age.
Yes, and this is a crucial starting point. You need to know upfront how likely this test is to trigger unnecessary panic and follow-up procedures, even if you are completely fine.
Like the stress tests.
Exactly. The 40% false positive rate for stress tests we discussed earlier is a perfect example of why this question matters.
It totally changes the context of the test.
It really does.
Okay then, my second question needs to force the doctor to think 2 steps ahead. I need to ask, what are the realistic treatment options if we actually find something?
Don't just tell me what we are looking for. Tell me what we are going to do about it.
Right.
It shifts the focus from simply gathering data to discussing actual clinical outcomes. If the treatment for a potential finding is a surgery your body can't handle anyway.
Then there's no point in taking the test to look for it.
Exactly. And that leads directly to the third factor you need to weigh. What is the procedural risk of that treatment?
Because people assume that if a doctor recommends a treatment, it must be inherently safe.
But every procedure carries risk, especially as we age. You have a right to factor that into your decision before you even agree to the initial diagnostic test.
Okay, so let's say we find something, but the treatment risks are just too high. That brings up the fourth tool in the framework. What happens if we just monitor it?
The concept of watchful waiting?
Watchful waiting.
Yes. Watchful waiting is one of the most powerful yet vastly underutilized tools in modern medicine for older adults.
Because it feels like you're doing nothing.
But you aren't doing nothing. For many conditions, especially the slow-growing cancers we discussed, simply keeping a close eye on it is a vastly superior option to immediate aggressive intervention.
It takes nerve, though.
It actually requires more courage from a physician to recommend watchful waiting than it does to simply order another scan.
I bet. Which brings us to the final piece of the defense strategy. Asking the doctor, what is the most effective non-invasive or lifestyle intervention available?
Because as we saw with Tai Chi for bone health.
Or simply managing blood pressure to prevent a stroke rather than scraping out a carotid artery.
Right. The non-invasive route frequently outperforms the surgical route.
So a false positive rate, treatment options, procedural risks, watchful waiting, and lifestyle interventions.
The most important takeaway regarding this entire framework is how your doctor reacts to it.
Oh, that's a good point.
A truly great physician will welcome these questions. They will respect you for asking them.
And if they don't?
If you bring out this framework and your doctor acts dismissive or makes you feel like an annoyance for wanting to understand the physiological risks to your own body, that is a massive red flag.
Time to find a new doctor.
It is vital information about whether that doctor is the right fit for your healthcare journey.
If we step back and look at the big picture here, the overarching theme is a massive shift in mindset.
A paradigm shift, really.
When you are in your 70s and beyond, the goal of your healthcare shouldn't be to generate a massive checklist of findings.
No.
The goal shouldn't be to make your internal organs match a textbook from when you were 40.
That's impossible anyway.
Right. The goal is to protect your independence, to protect your energy, to allow you to keep fishing on the weekends or gardening or whatever it is that makes your life yours.
It is about changing how we view the human body as it ages. The current medical system often treats the older body like a corporate ledger.
A ledger.
Yeah, a list of liabilities that need to be aggressively audited, quantified, and zeroed out at all costs.
Wow, that's a grim way to look at it, but it's true.
But what if the next major leap in medical science isn't a new piece of technology at all?
What would it be?
What if the real advancement is a cultural shift? A move away from treating our bodies as commodities to be continuously audited, and instead treating them as delicate ecosystems to be respected, supported, and sometimes gently left alone.
That is an incredibly profound thought to ponder. Moving from a corporate audit to respecting an ecosystem, it really takes courage to step off the autopilot and view your health through that lens.
It really does.
Thank you so much for joining us on this exploration today. We hope this empowers you to ask the right questions, understand the mechanics of your own care, and truly take control of your health journey. Until next time, take care.